Basically, CKD is a condition characterized by a gradual loss of a kidney function over time. And particularly this over time means that it's over 3 months or more than 3 months. Now, it actually includes a condition that damage our kidneys and decrease their ability to keep us healthy by filtering the waste product from our blood. In fact, we actually have a rapidly rising kidney failure cases, and then in fact, you can see that about 6 people are diagnosed every day, which is a 3 times increase compared to 20 years ago. And it's actually estimated we do need to build about 5 dialysis centers every year to cope with the increases in Singapore. Now, diabetes is the single most leading cause of CKD in many parts of the world, including Singapore. In fact, 2/3 of dialysis patients in Singapore actually are having a diabetic kidney disease. Now, if you look at the statistics of the world, and you can see if you look at the cost of newly diagnosed end-stage kidney failure starting with dialysis. Now, based on the cost or etiology, Singapore actually have the highest, with Singapore ranked to the top of the world. So we actually are champion in terms of diabetic kidney failure. And the second is actually followed by Malaysia. But having said that, Malaysia and Singapore, by sharing the same cultural and social economy, and also our lifestyle, and they always take turns, to become the top of the world in terms of diabetic kidney failure. So what diabetes causes to the kidney? So let's say this is a kidney, and this is the small diagram of the filter. I mentioned this is the glomerulus, this filter, a small unit of a kidney. It's about 1 million in each kidney. So this is healthy. When having a diabetes, it can cause damage of the filter and start leaking protein. That's the first sign of a diabetic kidney disease. Now, do we know we have a chronic kidney disease? Now, unfortunately, that's a problem. Many people do not have any symptoms until at one stage of a kidney disease. We do not have a pain because there's no pain fiber in the kidney. We only have the capsule surrounding kidney. So when you have chronic kidney disease, you do not feel the pain. Most of people do not feel anything at all until very at one stage. Now, having said that, some people may actually notice a lot of bubble in the urine, we call frothy urine, or may have puffiness, or swelling around the, especially in the morning, or some swelling of the feet and ankles, or need to urinate more often, especially at night, or feel more tired, or less energy, or having trouble to eating, or having a poor appetite, or have nausea or vomiting, having issue with sleeping, muscle cramp, especially at night, or dry or itchy skin. But those are the only minority of patients, especially when you reach the advanced stage. Right? Otherwise, most people do not have any symptoms at all. So screening is important to identify CKD before it's too late and get a shock when you reach end-stage kidney disease.